Watching your hair thin out is a deeply frustrating biological reality. To stop this process, you need to transition from trial and error treatments to a medical regimen backed by clinical data. The cornerstone of this specific intervention is a pharmaceutical tool, the Lonitab tablet. Before you begin, you need two things in hand: the physical medication and a valid prescription from your physician. Our objective today is to build a rigorous daily routine around this medication to ensure you are taking it safely and effectively. A patient must manage the timing of each dose and monitor their systemic response to ensure the medication works safely and effectively. Step 1 in this protocol happens before you even open the package. You must visually audit the physical medication. Look closely at the packaging. You need to verify the manufacturer is Intas Pharma and that the active compound listed is Minoxidil. You will typically find this available in 2.5 milligram and 5 milligram strengths. From an economic standpoint, a standard 10-tablet strip of the 2.5 milligram variant generally retails for around 150 rupees at most pharmacies. Now, let's look at the active ingredient. Minoxidil is a unique compound with two drastically different medical applications. This split-screen diagram highlights those distinct functions. On the left, we see its cosmetic application, acting as a potent stimulant to revive dormant hair follicles. On the right, you see its original medical purpose, expanding constricted blood vessels to treat severe hypertension or high blood pressure. Because it actively dilates your blood vessels, introducing this compound into your system without accounting for its cardiovascular impact can be dangerous. Understanding exactly how a drug affects your entire circulatory system is a mandatory prerequisite before utilizing it for localized hair growth. Moving to daily administration, the standard baseline requirement for hair loss is the 2.5 milligram dosage, taken once a day. This timeline outlines the most critical environmental rule. You must ingest this tablet exclusively within the post-meal administration window. Taking it on an empty stomach disrupts how your body absorbs the compound and frequently triggers severe gastric distress. Consistency dictates the outcome. Set a dedicated alarm to ensure you administer the dose at the exact same time every single day. The biggest psychological hurdle you will face is the urge to abandon the regimen early. In the first few weeks, you will likely see absolutely zero visible hair growth. Biological cellular changes operate on prolonged timelines. During these initial stages, strict adherence to the schedule is your only true metric of success. While daily administration becomes a habit, your weekly routine must include active surveillance. Safety requires constant monitoring for adverse systemic reactions. We monitor this using a 4-point checklist. As highlighted in Quadrant 1, the first physiological warning sign is the sudden onset of severe cranial pressure or persistent headaches. Second, watch the scale. A rapid, inexplicable trend of weight gain indicates fluid retention. Third, pay close attention to your heart rate. A rapid, fluttering, or erratic heartbeat requires your immediate attention. Finally, be aware of increased susceptibility to illness, which points to a critical drop in your white blood cell count. If any of these 4 markers trigger, the required action is non-negotiable. Halt the medication instantly and contact your physician. In any pharmacological intervention, your systemic health must always take absolute priority over your cosmetic goals. We have now established the 3 pillars of this routine: physical medication verification, strict post-meal timing, and active side effect monitoring. The ultimate rule is endurance. Maintain this exact cycle continuously until structural hair growth is achieved, or until your doctor instructs you to stop. By treating this process analytically and prioritizing safety, you are maximizing your chances for a successful outcome. If this structured blueprint helped clarify your treatment plan, please like and share this video with others navigating hair loss. Thank you for watching Medicine Review. Remember, the most successful medical outcomes are driven by highly informed patients.